There's one symptom that can send a jolt of pure panic through just about anyone. Chest pain, right? Your mind just races. But what if that terrifying pain isn't what you think it is? What if it's a medical mystery with a surprisingly calm solution? So today, let's talk about Tietze Syndrome. The second you feel that twinge or that sharp stab, your brain jumps straight to the worst-case scenario. We all do it. Heart attack. Call an ambulance. And look, for good reason. But that's not always the end of the story.
Sometimes the actual cause is something way less scary, something most of us have never even heard of. It's a condition that puts on a great performance, mimicking a total catastrophe, when in reality, it's just an inflammatory issue that we can manage. And that's what we're diving into.
All right, so let's get right into it. What in the world is Tietze Syndrome? Okay, so here's the official breakdown. Tietze Syndrome is rare and it's benign. That means non-cancerous. But the two words you really want to lock onto here are localized and swelling. It happens in a very specific spot, right where your ribs connect to your breastbone, and it creates this tender and often visibly swollen lump. Now, this isn't some brand new thing. It was actually first described way back in 1921. It tends to pop up in people in their 20s and 30s, but honestly, it can happen at any age. And even after 100 years, it's still a real challenge for doctors to diagnose, mainly because they have to be absolutely sure it's not something more serious first.
And the signs are super specific. The number one giveaway, the hallmark of Tietze, is a firm little swelling that you can actually feel with your fingers. The pain is sharp, usually hangs out around the second or third rib, and boy, does it get worse when you cough, sneeze, or even just take a deep breath. And get this, even though it's in your chest, the pain can shoot out to your neck and arms. But it almost always just picks one side of the chest.
So to really wrap our heads around this condition, let's move away from the textbook and look at two real-life patient stories. This is where it all starts to click.
We've got two really different situations here. First, a woman who walked into the doctor's office pointing right at the problem. Her symptoms were obvious. And then we have a man who had no clue he even had this. It was found completely by accident. This contrast just shows you what a puzzle it can be.
Let's start with our first patient. Picture this. A 38-year-old woman shows up at the clinic with a very clear complaint. For a whole month, she's had this pain and a lump on her chest she can see and feel. When they dug into her story, it all seemed to start after she did some heavy exercise at home and felt a strain. Sure enough, there was a noticeable kind of hard swelling on her chest, a little red too. And just like the textbook says, it hurt more when she strained. But here's the most important part. She'd already seen a cardiologist. Her heart was totally fine. That gave her doctors the green light to look for something else. Okay, now let's flip the script entirely. Our second case is a 35-year-old man who was in the hospital for something completely different. He wasn't complaining about his chest at all.
So he comes in with stomach pain and a nagging cough. As part of a routine workup, they do a chest scan. And that's when they see it. Something weird. The spots where his ribs joined his breastbone looked different. They were described as widened and flattened. And it wasn't until a doctor physically pressed on those spots that the man said, "Ow, yeah, that's a sharp pain." It was hiding in plain sight the whole time.
So you've got these two totally different stories. How on earth do doctors connect the dots and actually solve this thing? Well, it's a very careful process of elimination.
The best way to think about it is like a funnel. You start wide with a good long chat about the patient's history and a physical exam, feeling for that telltale lump. Next, and this is absolutely critical, they rule out all the big scary stuff like heart and lung problems. Once that's all clear, they can zero in with some lab tests to look for inflammation, and finally, they bring in the imaging to get a direct look.
So what are they actually seeing on these scans? Well, this quote from the 35-year-old man's case really paints a picture. The CT scan showed actual physical changes to his ribs. They were widened and had an irregular shape. This is the kind of concrete proof that helps put the final pieces of the puzzle together.
But, while CT scans are helpful, both of our sources say that the real star player here is often the ultrasound. Why? Because it is fantastic at looking at soft tissue. It can clearly show the swelling and the inflammation in the cartilage, all without any radiation. It's fast, it's safe, and it's incredibly good at what it does.
Okay, we absolutely have to talk about this because it's super important. You might have heard of a condition called costochondritis. It sounds almost identical, same area, same pain, same inflammation. But there is one single massive difference. Tietze syndrome has that visible physical swelling. Costochondritis does not. That one sign is everything.
All right, so we've defined it, we've seen it, and we know how to diagnose it. So what's the big picture here? What happens next, and why is knowing about this rare condition so important?
And here is the really good news. The treatment is usually pretty simple. It starts with the basics, rest, and just avoiding the things that make it hurt. Your standard anti-inflammatories, like ibuprofen, are usually the first thing to try. A little bit of heat on the area can feel really good too. For stubborn cases, a targeted injection can work wonders, but surgery almost never happens.
So does it work? Let's go back to our first patient. Remember her? The woman with a month of pain and that visible lump. After starting this simple treatment plan, how long do you think it took for her symptoms to go away? Just 1 month.
That's it. 1 month, and she was completely back to normal. And her case is pretty typical. This thing is what we call self-limiting. It goes away on its own. For most people, the pain and swelling are gone in a few weeks or months. Imagine the relief after thinking you might have a serious heart problem.
And this quote right here, this really gets to the heart of why this matters so much. Recognizing Tietze isn't just about treating a sore spot. It's about easing the incredible stress and anxiety that comes with any kind of chest pain. It saves time, it saves money on unnecessary tests, and it gives a patient something priceless: peace of mind.
So what's the big takeaway from all of this? Look, any chest pain needs to be taken seriously, period. But knowing that conditions like Tietze exist can change the whole dynamic. It can turn a moment of sheer panic into a more thoughtful process of discovery. It helps us all have a better, broader conversation. So I'll leave you with this. How can this knowledge change the way we approach one of the scariest symptoms a person can have?